Welcome to our Beyond 20 campaign, a celebration of One Joshua Group's 20 years of service excellence. This is a One Joshua Group production, providing access to information and experts to help improve quality of life and health outcomes.
Thank you for joining us for LifeBeat. We are extremely privileged and excited to have as our guest today Dr. Carli Culjat. Dr. Culjat, thank you very much for joining us.
Absolutely. It's a pleasure to be here.
Good. So, Dr. Culjat is a nurse practitioner that's critical in our discussion was center around nursing and some of the other interests of Dr. Culjat. She's particularly interested in health literacy, very, very important discussion and information around cultural humility, health policy in diverse populations. And much of her work focuses on improving community based health communication strategies and the importance of the role of communication in changing health outcomes, particularly when we consider who our audience is, what the message is, who the messengers are, and the value and validity of those people who are providing the messages. Um, we believe, and the data shows, the literature shows, and Dr. Culjat would tell us that these communication strategies are critical interventions in how we look at culture and some of the linguistic barriers in improving health outcomes and just generally talking to people. I know in our everyday life, what you say, how you say it, how you say it, it's just as important, if not more important, than what you say. So, Dr. Culjat, we're going to jump right in here. We introduced the fact of the importance and the criticality of communication, particularly if it is transactional versus relational. Why is cross cultural communication critical to improving health and health equity?
Absolutely. So I think the core of that question is this idea of what cross-cultural is, like really defining what that is and how it's going to improve things. Everyone, I have a true belief in practice. So I'm a nurse researcher and scientist, but I still maintain the practice, as you mentioned, and I work in the emergency department, and I've been a nurse since 2012. And to me, in all of that experience, and as a researcher, everyone carries their own culture. So what we are doing as a profession and what we're doing as a system right now in healthcare often is that we put people in boxes. And so you are XYZ, this is your presentation, this is how you present, this is what you are saying or where you're from or your zip code or who you identify as, and how we can cross those checks, those boxes is how I would communicate with you. And that's just simply it's not good for people. It's not good for everyone involved. And it, to me, it's a systems fix. It's a systems method to be able to provide care quickly, efficiently, and kind of uniformly.
Mhm.
And cross-cultural communication is this idea where somebody who's sitting across from you has their own culture, in so many ways and dynamics, and they're not only their culture of who they are, where they're from, their preferences, their lived experiences, but how they're interacting with the system that we're trying to navigate together. Healthcare is often not necessarily health, but sick care. It's tough
Mhm.
times. Working in the emergency department, that is not a place people want to be often. And it is the front door of the system in so many situations. And so when you're discussing with people what's going on and talking about health and wellness or even sickness, culture is not just their culture of who they are as a human, but their experiences in our system, how we engage with them, their past experiences, what they've been told. So you ask why cross-cultural communication is critical, and that is because we can't talk about health or health equity until we talk about people sitting across from each other and what that means, and creating that space to elevate instead of look at them as a barrier,
Mhm.
what people are bringing to the table.
So you mentioned being a nurse practitioner. And first of all, thank you for the work you do in the emergency department. That's certainly very different than someone being admitted from the hospital because it's straight from the street. It's in a stressful situation.
Mm-hmm.
I think when you talked about parameters and putting people in boxes, we don't have a great deal of time in triaging to be able
Mm-mm.
to get people to understand what it is you're trying to convey. So the strategy of culture and communication is certainly important in that equation. But in the 1+1, there's that other element of health literacy.
Mm-hmm.
What about the role of health literacy in creating the equation that includes cultural communication?
Yeah, and I think the health literacy to me is it's a complex, often not it's not a construct that's holdable. In the United States, we've defined it for years as the ability to obtain, understand, and use health information. How we measure health literacy or how we um, evaluate somebody's health literacy is often incredibly tied to their literacy level, their reading and writing capacity. And there's that in and of itself is a problem. There's embedded racism, embedded structural barriers, embedded elements. But I can tell you right now that my family, my grandparents, the literacy doesn't preclude them from participating in health. So to me, when I walked into my role, into wanting to be a researcher and add to what we see this idea of health literacy as, is communication is not tied specifically to reading and writing. In fact, conversation and engaging with one another is much more powerful for individuals to obtain, understand, and then utilize health information. So, recognizing that health literacy in the US often has this burden, I think, associated with it because of the structural racism and because of the barriers and because of the isolation that it definitely puts individuals in. But health literacy to me is the ability to conversate. How
Mm,
how are we able to do that conversation? And when we take that perspective and flip that, it is no longer the patient's problem. It's not the consumer's problem. It is now the system's problem to be able to figure out how to match what they're bringing.
mhm,
And so often, health literacy, I think, is this idea that there you have low health literacy or you have inadequate health literacy. It's bimodal. You are or you're not. You're in or you're not. And you can read or you can't. Well, I know plenty of lawyers who can read just fine and they still don't understand what diabetes is. It's just truly what it is, right? And so it's not about that. It's about the conversation that we have and really being able to elevate that information to a place where individuals can pull what they need and how they need it, when they need it, about what they need to make those decisions. So
mhm,
health literacy contributes to health communication, I think, in a way that we as a society, as a culture, as a system of healthcare have yet to get to. We are
mhm,
not there yet, right? We still often offload that burden onto the patient. We often still very much so create systems or solve this complex problem with really
mhm,
not so complex interventions, right?
mhm.
And so I think that's a really that's at the heart of this is health literacy shouldn't necessarily just be literacy.
We're going to come back and look at two areas you mentioned, one
Mm-hmm.
being policy and another being those issues that are systemic. And you raised something that I believe that we often overlook or just don't have the consciousness level about. You stated that literacy is not just reading and writing, it's a lot about conversation as well. One thing that we overlook because of a lack of awareness are facial gestures, hand gestures, body language,
Mm-hmm.
language, language, whether it's verbal language, body language. At the community level, we hadn't talked about community engagement yet. Are you familiar with programs that help improved literacy, strategic communications, where we've really used something other than just survey tools to find ways to practice. We practice it. We don't practice health. We
Right.
practice the violin, we practice singing,
Hmm.
practice being a gymnast, but we don't practice health. We survey health. You have any examples in your locale or your work as a researcher where the community has been involved in learning more about strategic communication dynamics?
Yeah, off the top of my head, I'm not in that body of research per se in
Right.
terms of
Mhm.
community-based communication in development and strategy. Um, my biggest thing is that I don't think the community needs to change. I don't think that they need to even be researched. It's our providers, our researchers, our system that needs to change. And so I know a lot of research about how providers walk into a room, how surgeons do an analysis, how nurses engage with individuals. There's a lot of research in that I could, pull forward, but the community doesn't need it. They're not the problem. We're the problem. And if we turn and look at us as the problem
Mhm.
and us as the needing to be modified, I think we become so much more powerful because that's what we can control. To one of your questions was this idea of modification of communication, and um, at the core of a lot of my research is this idea that health communication, just communication in general, I run into a lot of barriers because people think they know how to communicate. We do. We talk all our lives, right? We're all talking all the time. That doesn't make it good. That doesn't make it therapeutic. That doesn't make it skilled. That doesn't make it modified. And the gestures and the hands and the movement and being true to yourself is one thing, but I think pulling in an example from, I've done a lot of communication training, and I think the intertwining of communication strategies. So there's a lot of research, actually in the business world, not the health world, in the business world about communication and the psychosocial, like psychology research talks a lot about communication, but tying in health I'm sorry, not health literacy, kind of health literacy tied in with cultural humility, not
Mhm.
cultural competency, and
Mhm.
this ever yearn for growth and understanding. I did a training in Oakland with Dr. Turvalon and Jan Marie Garcia on
Mhm.
cultural humility, and they really were the leaders in a lot of this, and some of the core principles truly pull in what we're talking about today, which is I'm not the expert. You're your own expert in yourself. I'm going to continue to always grow. There is no end goal here, there is no end point whatsoever.
Mhm.
And it's turning in and saying what I need to do in order to continue to be somebody who's addressing power, somebody who's addressing the dynamics and structure. So, those core principles tied in with this idea of communication strategies, that's where I think the science hits really hard. That's where I think we need to create the interventions. And um, there are some trainings, but again, so often I step back and the burden's placed on an individual. Just even I can give an example of yesterday. I was in um, the hospital setting with my mother, who's caregiving for my grandmother and grandfather. And my grandfather was just in the hospital, and the physician was talking to my mom and has spoken to her many times at this point. And it was just two different pieces of communication, right? Because medicine is a different language.
Mhm.
Medicine is a heavily different language. And then they're coming into English, going from medicine to English, but it's at a scholastic level, it's at a high
Mhm.
level of communication. That is not where my mother was communicating. So to
Right.
be able to sit and translate what was going on was really interesting. And she looked at me and she's like, I just said that. I was like, I know you said it, but I didn't. You said it differently.
Mhm.
And at the moment of time when that got exchanged in the hand gestures and thinking to that, it's all the body language. It's the moment of respect that's
Mhm.
exchanged that definitely makes communication the most powerful tool in the room and also the biggest barrier, right? In the ER, we practice seconds. You have seconds to try to define respect.
Mhm.
seconds, because it's going to move how communication moves. And so I think that's where a lot of the research has to go, is how do you form immediate respect with somebody? How do you earn it? How do you gain it? How do you embark on this journey together so quickly? And how does it start with respect and cultural humility, moving through communication, so together you can make those impacts and next steps? Long-winded answer. Hopefully that was a lot of information dropped in about that.
It was a lot of information in it, and it gives me several opportunities to come back and say that your comment about people not being broken, but the system intervention is noted and well taken.
Mm-hmm.
The second point that you made that's so very important, that would help us eliminate the inequities, would be respect. It's
Mm-hmm.
clearly about respect. If we were respectful, the issue of health inequity, economic inequity, they would just disappear. If we could clearly be respectful. So what you said could have been a long-winded answer, was at least 2, 3, 4, 5 nuggets that we believe our audience will be able to remember. And some of these areas, particularly cultural humility, I think will also help us eliminate some of the barriers and help us better understand where those opportunities are to change that. Around health literacy, I was listening to your story, and we all have mother, grandparent,
Mm-hmm.
caregiver
Mm-hmm.
stories. How do we utilize literacy and communications to become better self-help advocates?
So from which perspective might I add? So as an individual obtaining that,
As an
how do we become
individual,
that?
right?
Mm-hmm. So I would give two pieces. One, the system is not meant for you to receive information in a way that you need often and quickly. I would say that it's really important as a consumer to keep asking those questions until you get it. Because oftentimes, as a provider, on the provider side of things, and I don't think this is well known, the system, we are trained, and this is a universe that, like, very general, so very broad. As a provider, I am often trained that things what I do are social justice or socially based or for the betterment of individuals and health. But what they don't ever say is that I'm working in a market system, in a market justice system that does not necessarily care about my social issues. It
Mm-hmm.
often, it doesn't. I can't say it often doesn't. It does not. It is a market system. So me as an individual, as a provider, I have benchmarks. I have a lot of pressure to continue to move things along and push and get through things, not because I want to, but because that's the system pushing on me. So as a consumer, keep asking those questions, because it triggers to me that you don't get what I'm trying to say.
Mm-hmm.
And I don't know you don't get it until we talk about it. So as a consumer, please keep pushing. Please keep asking those questions. Please keep moving forward. And then secondly, and this is for the consumer side of things as a patient, if you're not happy with your answer or you don't understand it, find an advocate for yourself. Find a cousin, find a neighbor, find somebody that you know knows enough about the system that can help you get in there, because it is a different language. It is truly a different language. So walking into an appointment by yourself is really tough. Having another set of ears and eyes and having somebody who has that language, has that skill and structure around the system, can go a very long way.
Mm-hmm. And so you point out something in the care receiving, the patient perspective, whatever the provider is. And I recently had that experience. The first thing out of respect is people need to know who you are. You just walk into a room. I had an experience recently, and I went to the dentist, and this person walks in the room and says A, B, C, and D. And of course, because I know Carli, I said, "So who are you, and what are you doing, and what are
Mm-hmm.
you going to do?" So we need to be sure that we are in a position to receive the message. but there's so many providers with different color scrubs, and we haven't
Hmm.
read all the manuals, and we don't know that this is a calming effect and why surgeons wear this color, and they may be in doing housekeeping before they come in, and you believe them to be. So on the provider side, helping the patient understand what the delivery is going to be. But on the patient side, as you mentioned, asking, what are
Hmm.
you here to do? What should I expect? And being comfortable to ask for what you need. And so that gives us some responsibility to help us be self health advocates. Now,
Hmm.
all this ties into how we achieve health equity. We're going to go back to your um, role, I will say, slash responsibility as a nurse. Tell us about how you see the role of nurses and nursing
Mm.
in addressing the health equity agenda.
Yes, that's a big question. I think that it's a big question because it has to have a big answer, is how
Mhm.
I say that. Um, Nurses historically are the ones who do a lot of this communication. And oftentimes it's not policy changing, but it's practice changing. So as a nurse, I can advocate, but I'm advocating the one-on-one, but not changing the system in which living in to make it better for all.
Mhm.
So often I really think nurses have a role in terms of updating procedures, updating policies. And I tell my students when I teach policy, I tell my students that a policy exists and you either work for it or it works for you.
Mhm.
And I think nurses really need to stand up and say that I'm no longer working for these policies and trying to find the ways around it and this innovation. And our nurses are known for innovation and
Mhm.
fixing and getting around anything. So instead of working for a policy, we need to own back that policy and make it work for us. And so that all of us follow the same idea, all of us have the same expectation and threshold so that we can hold each other accountable.
Mhm.
Um, I think so policy is a big thing. I think a second piece where nurses need to step in and really step up is accountability. And
Mhm.
accountability not only for health equity, but to and from each other.
Mhm.
Because if we're starting to hold each other accountable and we
Mhm.
hold our other providers and other professions accountable, that's where change occurs, is accountability setting and meeting,
Mhm.
right? Like I can't meet an expectation that's not set, but I very much so cannot hold others accountable for
Mhm.
expectations that aren't present
Mhm.
or well defined or clear. And the piece to that is that health equity, we often, it's a big word, right? Like, oh, health equity. How? Right? We know why health equity is important. What about health equity, and then how are we going to do it? So really start tapering those things down to the individual nurse and unit, and using the science and evidence that we have, and it's what are we going to do about it and how are we going to do it. And I'm very tired of hearing health equity. No, no, no. What specifically can I do today? Can I practice over the next 6 weeks to improve as an individual in a profession that we can all do and then hold each other accountable for to make the next steps? So I think that's where I think I see definitely nursing can push forward. That happens in our schools, that happens in our practice, that happens in all of there's thousands of roles of nurses.
Mhm.
So if we could do that as a uniformly as a profession, we would make huge change, like massive change.
Yeah. My sister's a nurse, and she was in an executive position and encountered what you just mentioned and decided that she couldn't make change there. So she
Mm-hmm.
is working with a community based organization now. And um, I think once a good nurse, always a good nurse. If you start talking to her in 5 minutes, you would say, "You're a nurse." And she'll say, "No, I'm not in nursing." And yeah, I understand that, but you're a nurse. So she just immediately goes to that nurse role. So
Mm-hmm.
I think that that's a commitment to improving health outcomes. You recently authored an article that looked at leaders in the future of nursing.
Mm-hmm.
Where does Dr. Carli Culjat see herself in the future of nursing?
Yeah. So definitely some short term, I hope it's short term, but probably more long term elements to a lot of this in where I'm at. I think we need some disruption. I think that as a profession, I would love to see myself asking the tough questions, and not just asking the tough questions, but then holding accountable to those changes that need made. So, for example, we've talked a lot about health equity and communication today, but we have, as a profession, as the nursing profession, we might have pillars, but what does it look like? And asking the hard question is how are we running into problems, and what are we going to do about it? And where is our profession needing to look in our own closets and skeletons and clear out some work? And how are we addressing the racism and the social inequities that we as a nursing profession continue to
Mm-hmm.
push forward and ignore? How do we get to those kinds of things? So that's definitely a role that I would love to play, is asking those tough questions. And I think in that discomfort is where growth will happen. And until we as a profession grow, we are not going to optimize our role in this push for health equity and push back against the systems that continue to give us the outcomes that we have. For example, one thing that I always have heard, and I said, I love this, I don't know who originated it, but our system is not broken. Our system is perfectly designed for what is happening.
Mm-hmm.
So never walk in thinking that this is broken. No, it is not broken. It is happy. The system is happy how it is. So until we recognize it, until we ask the hard questions and dive deeply and check our own selves as a profession, we can't move that needle. We can't push back and really make those questions and ask those big questions. So I would love to be that kind of catalyst for those changes, even if it's small to big, and what it looks like in academia, how we do research, how do we own a research space as an individual without having a commitment or collaboration with the community? What a simple question. But I don't think we ask it of each other. How, as an educator, did I make sure that I checked my biases, because we all have them, before walking in and doing some education and being open to the different views that we're going to have to do? We don't ask ourselves that question. And so what do we need to start doing as a profession? And that's really what I would love to do, is really push kind of that change making agenda of what's the question, defining the problem, and getting on with it, almost. Like, let's go. It's time to go.
Well, that's wonderful. And as we talk about walking the walk and talking the talk, tell us about the Culjat Scholarship.
Oh, yeah. I was really excited about that. I don't often get asked about this. It is a scholarship that my siblings and I all do. So I am the oldest of three. I have a younger sister and a younger brother, and the three of us were raised by my mom, who's a single mom. And we came together and actually put together, my mom went to the community college for a couple courses, and it was hard. It's very hard to continue. And she went for some special, I think she has some work in cement work. Like, she has a degree in cement, or not a degree, but some courses in cement work, like for her job that she did. And it was great. But my brother and sister and I mean, I'm a professor. I have multiple degrees. My sister is huge in finances, working in an exceptional brokerage firm, and my brother is a neurosurgeon resident. And all three of us, are from my mother, who is a single mom in this community. So the scholarship is all of us coming together to provide funds for a single mom who's trying to make a change in her life, and knowing one of the prompts that we love to ask is how this change is going to help her change her children's future, because my mom's hard work changed our future. You know, we're very different lifestyles, but that's okay, because we came from that, and there's still hard work, there's still respect for others. That's where that drive for respect comes from, I think, in all three of us and across our professions. So,
Well, congratulations on doing
thank
that.
you.
That's very important, and that's how
Yeah,
you grab the bull by the horns and make a
yeah,
difference. But most of all, where we walk the walk and talk the talk, and make a change for other people from our experience and those
Mm-hmm.
things that make our lives important as we look at intersectionality, if you would,
Mm-hmm.
and where
Yeah.
these interventions take place. We greatly appreciate the time that you spent with us, and we want to ask you as a message to our listeners, our viewers, and our listeners. What would you like to leave as last thoughts for those people who view this Life Beat
Mm.
podcast?
Okay. Uh, Whether you're a consumer, which all of us are, or a practitioner or a provider or someone working in healthcare, I hope that you take it upon yourself to know that what you're doing and striving for is right. You have rights to information and time to get that information that you need. Keep pushing. The system is not meant for you to get what you need when you need it. So don't succumb to the gaslighting that is our system often, and keep fighting for the right thing. Find others who are also doing that, because when you're in a community, there's safety in community, there's strength in community. So find others who are also going through that, and keep pushing forward. And the one thing that you can change on a daily basis for yourself, for your others, for the caregiving role, you as a provider, is a world of difference for others. So don't think of it as a small thing.
So we greatly appreciate that. And you've heard it first through this Life Beat podcast. And you heard it from Dr. Carli Culjat, who is at the Florida State University as an associate professor. She's in the College of Nursing and the Center of Population Science for Health Equity. Thank you so very much, Carli, for joining us. We will talk to you soon. And for those
Yeah.
of you who are in our listening and viewing audience, Dr. Culjat told you, first of all, we'll tell you lastly, be kind, be thoughtful of others, and also be considerate and respect. Thank you. Join us for our future podcast.
This edition of Beyond 20 is a Life Beat podcast sponsored by One Joshua Group, your strategic source of engagement to improve life through better health, education, and information. For more information, visit us at theonejoshuagroup.com or follow our work on LinkedIn, Facebook, Instagram, and Twitter using hashtag OneJGCollabs. One Joshua Group, building capacity, expanding resources, joining what you know with what we've learned.